Osteology. Anatomical Principles of Endoscopic Sinus Surgery, a step by step approach by Renuka Bradoo. Don't lose the woods for the trees, get the whole picture first. Chapter 2 Osteology. There are two ways to study any concept: the Swiss cheese technique, in which one picks out the most important salient features first and gradually gets the idea of the whole concept. The second is the building block technique, where one breaks down the whole concept into its component parts, studies each part separately, and then puts it together again to form the whole picture. We will use this building block technique to study the complex anatomy of the lateral wall of nose. The cadaveric head, when cut in the immediate parasagittal plane, reveals the lateral wall of nose. On first impression, this area appears as a series of elevations and depressions. The lateral nasal wall extends from the nasal vestibule to the posterior choana, which is formed by the medial surface of the medial pterygoid plate. The nasopharynx extends beyond the posterior choana up to the prevertebral muscles. What strikes us immediately is that the nasal airway extends up to approximately 50% of the distance of the entire sagittal section of the head. The nasal mucosa is stripped of the underlying bones. We will see that the lateral nasal wall is formed by 8 separate bones, each of which have processes that articulate intricately with each other. There are four large bones: the maxilla, the frontal, the ethmoid, and the sphenoid, and four small bones: the inferior turbinate, the lacrimal, the palatine, and the nasal bones. Of these, the frontal, ethmoid, and sphenoid are single unpaired bones in the midline of the skull. The others are paired bones. Hence, although there are two sphenoid, two frontal, and two ethmoid sinuses, there is only a single sphenoid, frontal, and ethmoid bone. We will now disarticulate all the bones and study the relevant anatomy of each bone. Having done that, we will rearticulate them to study the lateral nasal wall as a whole. Parasagittal section of the head. Articulated bones that form the part of the lateral nasal wall. Disarticulated bones. Maxilla. The maxilla. The maxilla forms the base or the framework on which the lateral nasal wall is built, and so we will study it first. The lateral nasal wall is formed by the medial surface of maxilla. What is most obvious is a large opening into the maxillary sinus. We know that in the live patient, the maxillary sinus opening is small and not easily seen. This is because the large opening in the maxillary bone is closed off by processes of different bones, which narrow the opening. These processes are the descending process of the lacrimal bone anteriorly, the uncinate process of the ethmoid bone anterior inferiorly, the maxillary process of the inferior turbinate inferiorly, the perpendicular plate of the palatine bone posteriorly. Certain areas are covered only by a double layer of mucosa of the nasal cavity and the maxillary sinus. These are the anterior and posterior fontanelles. Occasionally, these double layers of mucosa may be dehiscent to produce accessory ostia. The normal maxillary ostium is hidden deep behind the intermediate portion of the uncinate process. Red, descending process of the lacrimal bone; green, uncinate process; yellow, maxillary process of the inferior turbinate; blue, perpendicular plate of the palatine bone. Anterior to the maxillary hiatus, the maxillary bone is drawn into a process which extends superiorly. Since the upper border of this process articulates with the frontal bone and the anterior border articulates with the nasal bone, this process is also called the frontonasal process of the maxilla. The medial surface of this process shows two crests. The upper one is the ethmoidal crest. The most anterior part of the middle turbinate is attached to this ethmoidal crest. The Agarnesi cells also overlie this crest anterior to the attachment of the middle turbinate. Pneumatization of this part of the frontonasal process along with the adjacent lacrimal bone contributes to formation of the Agarnesi cells. The lower crest is also called the conchal crest and gives attachment to the inferior turbinate. The smooth area below the conchal crest forms part of the inferior meatus. Immediately behind the frontonasal process is a groove. This groove is closed by the lacrimal bone and the lacrimal process of the inferior turbinate to form a canal for the nasolacrimal duct. The frontonasal process is a thick bone, whilst the lacrimal bone is quite thin. Therefore, it is interesting to know that although the lateral wall of the nasolacrimal duct is formed by thick bone, its medial wall is formed by fairly thin bone, which can be easily damaged. Posterior to the hiatus at the junction of the medial and the posterior wall of the maxilla is a roughened area called the maxillary tuberosity. This area has an oblique groove which, when completed by the perpendicular plate of the palatine bone, forms the canal for the greater palatine vessels and nerve. The endoscopic surgeon must also understand the anatomy of the roof of the maxillary sinus and its posterior wall. The roof is formed by the orbital surface of the maxilla and is marked by the infraorbital canal, which may sometimes be dehiscent to expose its contents, namely the infraorbital vessels and nerve. The posterolateral wall of the maxillary sinus is smooth and featureless and comprises of fairly thin bone. It separates the maxillary sinus from the pterygopalatine fossa medially and infratemporal fossa laterally. Frontal bone. The contribution of the frontal bone to the lateral nasal wall is best understood by looking at its basal view. In the center of the bone is a hiatus, which is filled in the living person by the cribriform plate of the ethmoid. On either side of this hiatus are a variable number of air cells. These are the anterior and posterior ethmoidal air cells. The roof of these air cells is the skull base or the ethmoid fovea. Thus, the ethmoid fovea is at a higher level than the cribriform plate. The lateral border of these air cells articulate with the lamina papracia of the ethmoid bone. It is at the junction of these suture lines between the lamina and the frontal bone that there exists the anterior and posterior ethmoidal foramina transmitting their respective arteries. Lateral to the lacrimal papracia, lamina papracia is the orbit. Anteriorly and in the midline, the frontal bone is elongated to form the nasal spine. This spine articulates with the nasal bones, which help in forming the anterior most portion of the lateral nasal wall. Ethmoid bone. The ethmoid bone is a single delicate bone consisting of numerous air cells, the ethmoid sinuses. It consists of a horizontal plate, that is, the cribriform plate, and a vertical plate in the midline, that is, the perpendicular plate. The perpendicular plate forms the posterior part of the septum. Ethmoid bone, coronal view, ethmoid bone in its axial view. The cribriform plate fits into the notch in the frontal bone and separates the nose from the anterior cranial fossa more specifically the gyrus rectus and the olfactory bulb. It is perforated by many foramina which transmit the olfactory nerves as well as the anterior and posterior ethmoidal arteries. On the upper surface of the cribriform plate is in the midline is a projection which is called the crista galli. The crista galli is occasionally pneumatized. On closer examination, the cribriform plate shows a horizontal medial lamella and an oblique or vertical lateral lamella. This lateral lamella articulates with the frontal bone. Thus, the skull base in this region, the ethmoid fovea, is formed medially by the lateral lamella of the cribriform plate, which is very thin bone, and laterally by the frontal bone, which in contrast is a thicker bone. The frontal bone forming the ethmoid fovea is 0.5 mm in thickness, while the lateral lamella of the cribriform plate is 0.2 mm. The region where the anterior ethmoidal artery pierces the dura medially is the thinnest area in the base skull and is only 0.05 mm in thickness. The length of the lateral lamella and the depth of the olfactory fossa are classified by Quiros in three types. Type 1 1 to 3 millimeter, type 2 4 to 7 millimeter, and type 3 8 to 17 millimeter. Lateral to the perpendicular plate on either side, the two masses of air cells, the ethmoidal sinuses, the cribriform plate, and the ethmoid fovea. 1. Horizontal lamella, 2. Lateral lamella, 3. Orbital plate of frontal bone, 4. Anterior ethmoidal artery. They are bounded medially by the middle and superior turbinate and laterally by the paper thin lamina pepracia, which separates the ethmoid from the orbit. Occasionally, there may be a supreme turbinate with above the superior turbinate. It is important to know that although the inferior turbinate is a separate bone, the middle and superior turbinates are parts of the ethmoid bone. The middle turbinate overhangs a space called the middle meatus. Similarly, the space under the superior turbinate is the superior meatus. Looking into the diagram, we can see the basal view of the articulated frontal and ethmoidal bones, perpendicular plate which is white, middle turbinate that is blue, and uncinate process which is green, ethmoid air cells which is yellow, and lamina pepraceae. The middle turbinate is a thin sheet of bone which curves in different planes, very similar to a dried leaf. Its most anterior attachment is in the sagittal plane to the frontonasal process of the maxilla and cribriform plate. It then turns laterally to be attached in the coronal plane to the lamina pepraceae. This attachment is also called the basal or ground lamellae. Its most posterior attachment is in the horizontal plane along the lamina pepraceae and the perpendicular plate of the palatine bone up to the roof of the posterior choana. A gently curved bony process lies almost free within the middle meatus, partially covering the maxillary sinus opening. This is the uncinate process. It articulates anteriorly with the lacrimal bone and its posterior end with the inferior turbinate and perpendicular plate of palatine bone. The ethmoid cells are divided into two groups. The anterior ethmoid cells, which lie anterior to the ground lamella of the middle turbinate and open into the middle meatus. The posterior ethmoid cells, which lie behind the ground lamellae and open into the superior meatus or sphenoethmoidal recess. The ground lamellae may be displaced anteriorly or posteriorly depending on the relative extent of pneumatization of the anterior or posterior ethmoid air cells. The ethmoid bulla is a large and fairly constant anterior ethmoid air cell. The ethmoidal cells are incomplete superiorly and posteriorly. They are complete superiorly by the frontal bone and posteriorly by sphenoid bone. The ethmoid cells tend to migrate into the surrounding bones to develop variable patterns of pneumatization. Here we can see frontal view of the articulated frontal and ethmoid bones, the articulated frontal, ethmoid and sphenoid bones. These parts of pneumatization include anterior superiorly into the frontal bone to form the frontal sinus, superiorly above the ethmoid bulla over the orbit and behind the frontal sinus to form the supraorbital cell, inferiorlaterally into the roof of the maxillary sinus as a halar cell hall, the inferior posteriorly above the sphenoid sinus as the Onodi cell, anteriorly into the lacrimal bone and frontonasal process of maxilla as agar cells, superiorly into the frontal recess to form the different types of frontal cells. Isolated cells may be present within the ethmoid infundibulum. These are infundibular cells. Sphenoid bone. The sphenoid bone closes off the back of the nasal cavity and separates it from the anterior and middle cranial fossa. It is in relation with the important structures. Here we can see the sphenoid bone. Important structures like optic nerve, the carotid artery, making a good understanding of its anatomy is very important to operating surgeon. Seen from the front, the sphenoid bone looks like, with a little imagination, like a bat with outstretched wings. The central portion is the body of the sphenoid, which is pneumatized by the two sphenoid sinuses. Anteriorly, in the midline, is a strong triangular process called the rostrum, which articulates with the wormer. Extending laterally from the central body on either side are a pair of greater wings and lesser wings. The retort shape superior orbital fissure lies between the greater and lesser wing. The lesser wing is attached to the body by two roots between which lies the optic canal. This canal transmits the optic nerve, which is with its meninges and the ophthalmic artery. A stout process extends downwards on either side at the junction of the greater wing and the body of sphenoid. This is the pterygoid process. It splits into the medial and lateral pterygoid plates. The medial pterygoid plate forms the lateral wall of the posterior choana. The lateral pterygoid plate is not in direct relation with the nasal cavity. The anterior surface of the pterygoid processes forms the posterior wall of the pterygopalatine fossa. Two canals transverse the pterygoid process and present as foramina on its anterior surface. The inferior medial foramen is the funnel shaped opening of the Vidian nerve for the Vidian nerve. The superior lateral foramen is a foramen rotundum which transmits the maxillary nerve. It is important to note that the foramen rotundum lies just a few millimeters below the superior orbital fissure. The sphenoid sinuses are variably pneumatized. They are very often asymmetrical, showing right or left sided sphenoidal dominance. Depending on the pneumatization of the sphenoid bone, the sphenoid sinus can be classified into the following types: conchal, a small pit like depression; precellar, extending up to the anterior wall of the pituitary fossa; cellar, extending up to the clavus. The pituitary forms a distinct bulge in the roof of the sinus. Mixed, the relations of the surrounding important structures are best understood in the cellar type. Posterior superiorly in the midline of the roof lies the pituitary bulge. Laterally and superiorly, the optic canal can be visualized, which at times is dehiscent. Posteriorly and inferiorly, the internal carotid artery bulge produces a prominence in the lateral wall. The sphenoid sinus may contain septae within it. These septae usually attach to important structures on the lateral wall of sphenoid sinus, like the optic nerve or the internal carotid artery. A recess called the carotico-optic recess exists between the optic nerve and the internal carotid artery. This is especially deep when the anterior clinoid process is pneumatized, and the optic nerve may be dehiscent in such cases. The inferior turbinate. The inferior turbinate is a separate scroll like bone. Unlike the middle and superior turbinates, it runs a fairly straight course from anterior to posterior. The right inferior turbinate view on septal side. One lacrimal process in orange and two ethmoid process in blue. In the diagram B, we note that the right inferior turbinate view on meatal side showing the maxillary process in green. Its inferior margin is free and overhangs the inferior meatus. Its superior margin is attached to the maxillary anteriorly and the palatine bone posteriorly. Approximately 1 centimeter behind its anterior end, its superior margin shows a peak or apex, which can be recognized in a live patient. The nasolacrimal duct opens into the inferior meatus at its peak. The inferior turbinate has three processes. Anteriorly, from its superior margin, is the lacrimal process. It is this process which forms the peak mentioned earlier. The lacrimal process articulates with the descending process of the lacrimal bone and thus assists in forming the canal for the nasolacrimal duct. A little behind the lacrimal process is another process arising from near the superior margin. This is the ethmoid process, so called because it articulates with the uncinate process of the ethmoid bone. Thus, to recapitulate, the uncinate process is attached to lacrimal bone at its anterior end and to inferior terminate posteriorly. A third process arises from the superior border but curves laterally to attach to the maxilla. This is the maxillary process. It closes off part of the maxillary hiatus and forms part of the lateral wall of the inferior meatus. Lacrimal bone. The lacrimal bone is the smallest and most fragile of the cranial bones. It separates the orbit, more specifically the lacrimal fossa, from the nasal cavity. The lacrimal bone articulates anteriorly with the frontonasal process of the maxilla, posteriorly with the uncinate process, superiorly with the frontal bone, and inferiorly it is drawn into a process called the descending process of the lacrimal bone. This, as we have discussed, articulates with the lacrimal process of the inferior turbinate to complete the medial wall of the nasolacrimal canal. The orbital surface of the lacrimal bone has a crest, which is the posterior lacrimal crest. The anterior lacrimal crest is on the frontonasal process of the maxilla. Between the two crests is the lacrimal fossa containing the lacrimal sac. The posterior lacrimal crest forms a hook inferiorly called lacrimal hamulus. Thus, this forms the upper opening of the nasolacrimal duct. The nasal surface of the lacrimal bone is pneumatized by an anteriorly migrated ethmoid cell called the agar nasi cell. Here we can see the right lacrimal bone, that is A, we can see this orbital surface, and B, we can see the nasal surface. Palatine bone. The palatine bone is fragile L-shaped bone which forms the posterior part of the lateral nasal wall and floor of the nasal cavity. It consists of the right palatine bone, one orbital process in orange, sphenoidal process in green, pyramidal process magenta, articulation with the inferior turbinate in purple. It consists of two plates, a perpendicular plate which forms the posterior part of the lateral nasal wall and the horizontal plate which forms the posterior part of the nasal floor. The perpendicular plate has a smooth medial surface which is covered by nasal mucosa. This surface is divided into three sections by two crests running along across it. The lower crest is called the conchal crest. The upper crest is called the ethmoidal crest. The conchal crest gives attachment to the inferior turbinate. The ethmoidal crest gives attachment to the middle turbinate. Thus, the area below the conchal crest forms part of the inferior meatus. The area between the upper crest is called the ethmoidal crest. The conchal crest gives attachment to the inferior turbinate. The ethmoidal crest gives attachment to middle turbinate. Thus, the area below the conchal crest forms part of the inferior meatus. The area between the two crests forms the posterior part of the middle meatus. Above the ethmoid crest is a narrow groove which forms part of the superior meatus. The sphenopalatine foramen opens into the nose just above the posterior attachment of the middle turbinate. It can, however, be approached through the middle meatus by detaching the middle turbinate from the ethmoidal crest. The lateral surface of the perpendicular plate is smooth above and forms the medial wall of the pterygopalatine fossa. Inferiorly, the lateral surface is rough and articulates with the maxillary tuberosity. Between the two bones lies a canal for the greater palatine vessels and nerves. The palatine bone articulates with the surrounding bones in the following manner. Perpendicular plate. The anterior border of the perpendicular plate has a prolongation called the maxillary process. It articulates with the maxillary process of inferior turbinate to close the maxillary hiatus. Posteriorly, with the medial pterygoid plate to form the lateral wall of the posterior choana. Inferiorly, it is continuous with the horizontal plate. Superiorly, with the maxilla by its orbital process and the sphenoid by its sphenoidal process. Horizontal plate. Anteriorly, it articulates with the horizontal process of the maxilla to form the nasal floor. Posteriorly, it has a free border, which is the posterior end of the hard palate. The palatine bone has three processes, two of which are at the superior border of the perpendicular plate. Of these, the anterior one is the orbital process, so called because it forms a small portion of the orbital floor near the posterior end of the inferior orbital fissure. The posterior process is the sphenoidal process called because it articulates with the body of the sphenoid. Between these two processes is a deep notch called the sphenopalatine notch. This is completed superiorly by the body of sphenoid bone to form sphenopalatine foramen. Thus, the sphenopalatine foramen get its name from the fact that it lies between sphenoid and the palatine bone. The third process is the pyramidal process, which extends posterior laterally from the junction of the perpendicular and horizontal plates. It articulates with the notch between the two pterygoid plates. It does not take part in the formation of the nasal cavity. Here we can see the nasal bones. Nasal bones. The nasal bones are two small rectangular bones which form the bridge of the nose. They vary in size and form in different individuals. They have two surfaces and four borders. The external surface is covered by processus and nasalis muscle. The internal surface is concave from side to side. It has a groove for the anterior ethmoidal nerve. The superior border articulates with the frontal bone. Inferior border is related to the upper lateral cartilage. The lateral border articulates with the frontonasal process of maxilla. The medial border widens into a vertical crest. It articulates with the opposite nasal bone and forms a part of the nasal septum. In the next chapter, we'll be learning about the lateral nasal wall. Thank you.